Hello, my name is Samantha Culver, and today, on behalf of West Labs, I'll be speaking to you about anorexia and bulimia. During this video, I hope to give you a better understanding of both of these diseases, as well as give you some information about the research that West Labs is conducting to understand them further. The first topic I'd like to discuss is a general description of these two diseases. Both anorexia and bulimia are eating disorders. This means that they affect the diets and lifestyles of patients dealing with them. Though they're the same type of disease, anorexia and bulimia are actually quite different. Anorexia nervosa is characterized by patients who refuse to eat, and thus they don't maintain a healthy body weight and tend to be very underweight, and this disease can even be fatal in some cases. Alternatively, bulimic patients fluctuate between periods of binging and purging. Binging is when they eat too many foods, often those that are bad for them, and purging is when they do the opposite. They either strictly diet or they try to eliminate that food. And one way that some do that is by self-induced vomiting. Bulimic patients tend to look closer to a healthy weight, but these behaviors are still very unhealthy and bad for their health overall. So up next, we'll talk about some of the symptoms of both anorexia and bulimia. There are a variety of symptoms, some of them more noticeable than others, both physically and emotionally and mentally. Some of the physical symptoms include weight fluctuation, decreased healing capabilities, an inability to maintain healthy body weight like we talked about with anorexia, as well as things like a brittleness in the hair, the skin, the nails, dental problems, dizziness, feelings of being cold, having dry hair and skin. And like I said, your weight can fluctuate. So even though these patients are trying to lose weight, their weight can go up, it can go down. In terms of emotional issues, they can have mood swings. Discomfort from eating in front of others can cause anxiety. And oftentimes these patients will lose interest in activities they normally enjoy. And then mentally, some of the problems have to do with a preoccupation with your weight, with your diet, with your exercise habits. And then one thing that also has been seen in bulimic patients pretty frequently is calluses that are present on the fingers and knuckles, which is a reduced of that self-induced vomiting. And that's another thing to kind of be on the lookout if you're worried about someone who might be experiencing one of these disorders. Though the symptoms of these diseases are extreme and can be very detrimental to the health and well-being of patients dealing with them, there are luckily quite a few treatment options. These treatments can happen in inpatient facilities, they can happen outpatient when the patient stays at their home and comes for appointments, or there can be sort of a hybrid of the two via partial hospitalization. Additionally, there are quite a few different psychotherapy options. One of the popular ones is cognitive behavioral therapy. Another newer treatment for anorexia involves keeping the patient warm and limiting their exercise while encouraging them to eat through positive reinforcement and positive feedback during their treatment, which helps recondition them into feeling more comfortable eating and feeling safe in doing so. In terms of demographics for these diseases, anorexia and bulimia are both more common among young people. Anorexia is a disease that's typically onset in the teenage years or the early 20s that can be persistent through the lifespan. And bulimia is more common in young people today than in any prior generation, meaning that there's more cases of bulimia present now than there have been in the past. Additionally, both anorexia and bulimia are about 3 times more likely to happen in women than in men. Anorexia affects about 1% of women and about 1/3% of men, while bulimia affects about 1.5% of women and 0.5% of men in America. Both bulimia and anorexia cause disruptions to the nervous system. There are marked impacts from bulimia, one of which is increased ghrelin production, which increases appetite, and that's due to the cycles of binging and purging. These cycles also activate areas in the brain that are also active during drug use in patients who suffer with drug addiction. This has to do with the levels of dopamine in the brain, which is similar how anorexia affects the brain as well. Anorexia has been linked to abnormal dopamine levels, which are caused by the weight loss that patients experience. There have also been observed similarities in patients with both anorexia and depression, but one does not seem to cause the other. They simply seem to be comorbid. And the use of antidepressant drugs have not been useful in treating anorexia. It was these nervous system disruptions that inspired our research here at West Labs. We want to be able to study the different levels of neurotransmitters in healthy brains and in brains of those with anorexia or bulimia. More specifically, we want to look at the role of the level of dopamine present and try to find a way to reintroduce dopamine into the systems of patients dealing with these diseases. Our goal in this is to develop a dopamine reintroduction treatment, potentially similar to the one used for Parkinson's patients, or even find a curative combination of psychotherapy and medication that could greatly improve the lives of those suffering from these diseases. Any grant money given to this project would be very impactful for continuing this potentially life-saving research. The references from this video come from Biological Psychology from James W. Collott, 2019, as well as the National Eating Disorders website, pages Types of Treatment and Warning Signs and Symptoms, both from 2018.